hear me? It's kind of awkward when it's behind us. What's that? All right. Is that better? First. I just want to say that Betsy and I were able to come on such short notice. I mean, Dean mentioned that there was an honoraria. So, otherwise we would have been here.
That was lunch.
That was what? So this is my boss, Betsey Daley, and I'm Joe Flores, and as was mentioned, I do Health and Human Services, or Health and Human Resources, for the Senate Finance Committee. Betsy's the director. First of all, thanks for the invitation. It's always a great opportunity to get out of the office, and I'm sure you're wondering what the heck we were doing from January to June. So hopefully we can shed a little light on that, even though it's a little bit painful since we just finished in June. I'm going to start off reviewing some of the actions that we took during the 2014 session. Betsy will pick up looking at the FY14 year-end numbers and discuss some of the revenue reforecasting that's in the works right now. We're going to look ahead to some of the challenges that we will face in the fall and in 2015, and then also touch on some of the challenges that you guys are facing at the local level. So with my apologies to Mr. Dickens, I kind of thought of the session as a tale of two sessions, and it was definitely the best of times and at times the worst of times, but I can guarantee you it was a long time. So in terms of the beginning of the session, it was the best of times. We had a little bit of revenue growth as we had the previous year, and Governor McDonald proposed a budget that funded a lot of things that we had to do, as Jim mentioned, K-12, Medicaid, the mandatory services that the Commonwealth is required to cover. And there was a slight increase, $200 million for higher education to make up for some of the reductions that we've made over the last few years. And then it was the worst of times because as the session went on and on, we found out that the deposits were looking worse and worse, and we actually pulled back most of the spending, certainly the discretionary spending, and trimmed a little bit of the quote-unquote mandatory spending in Medicaid and in K-12. So just to give you a high-level overview, Medicaid, the inflation, Medicaid utilization inflation, basically just covering caseload and cost increases was about $700 million for the 15-16 biennium. K-12, which is your other large area, re-benchmarking, which is akin to Medicaid in terms of covering enrollment and the cost, basically salaries paid for teachers, ate up about almost $600 million. There were requirements to pay for the rainy day fund deposits. There was funding for debt service, as Jim mentioned. The main discretionary piece on this list was higher education, and nearly all of that went away when we finalized our budget. This is what Governor McDonald originally proposed. In terms of spending reductions, we have been transitioning individuals out of our training centers. I'm sure you guys are dealing with that at the local level, depending upon where you are. There was almost $85 million in general fund spending reduced from the budget as we downsized some of our facilities. There was funding reduced from K-12 for non-personal inflation costs. There was a little bit of funding that was freed up, about $56 million related to some enhanced federal Medicaid funding related to the Affordable Care Act, and then you'll see the list there. So it was about $2.7 billion in increased costs, offset by about $900 million. Sorry, I'm on the wrong slide. So it's about $900 million in reductions. Prior to the final budget, some of the goals that we had envisioned in our Senate's budget as we put it together was to sustain some of the investments that we made and put some money back for higher education, for public ed, and for workforce training. There was additional funding put in for mental health services in response to need, but also what happened in November with Senator Deeds and his family. And then there was some funding for victims of domestic violence. There was certainly a major initiative on the part of the Senate to try and close the coverage gap for individuals with income under 138% of poverty. There was funding for teachers, state employees that haven't received increases in, I think it's 6, maybe going on 7 years, in terms of a salary increase, not bonuses. As Jim mentioned, there was a commitment to fund our VRS commitments, and then also, fundamentally, come up with a structurally sound budget that the House and the Senate agree on that. So I'm going to turn it over to Betsy now, that gets to talk about revenues.
We're going to talk about the worst of times. Let's see the best of times. I think, as you all know, we still found ourselves in session. We were actually in special session 1 because the regular session had ended without a budget, and that's because of this philosophical difference between the Senate and the House in terms of Medicaid expansion. We had an alternative product called Marketplace Virginia, which tried to take advantage of some of the efforts in other states that we had observed, and Joe will talk a little bit more about this in a minute. But we were trying to find a way to take advantage of federal funds that would come our way, that we would have 100% funding for this initiative for a few years, to take advantage of the fact that we were sending quite a few dollars to the federal government for these to support this program, and we wanted to claw some of that back. And also, frankly, there were some budget savings to be had. So, we thought it was a win-win. We could not get any traction with the House in terms of even having dialogue on it. Supposedly, that will take place in September. I'm not going to hold my breath. We'll see. I'll be optimistic. I'll be a glass half full gal for a little while anyway. So anyway, we were still in May. We found ourselves without a budget. And about this time, we were talking to Rick Brown, Secretary of Finance, and he said, I really don't think we're going to make the forecast for 14. And we're like, well, what are we talking about here? A couple million, 50, 100 million, what are we talking about? Because in context, just to give you some context, we had already, in the mid-session in February, he said, I really think I need to take FY14 down. So he recommended that we take down FY14 125 million, which we did, and candidly, that was pretty easy to do because where we were in the budget. It took FY15 down by about 15 million. So we thought, well, it can't be a whole lot more. Well, the numbers, as we talked, the numbers got bigger and bigger, and as you know, we ended up budgeting or planning for about a $1.6 billion revenue shortfall in 15 and 16, based on what was going on in 14. There's Delegate O'Bannon. I probably shouldn't have said those nasty things about that. Didn't know he was still there. So anyway, we were having a difficult situation here with the revenues, trying to figure out what to do, and there were a couple of dynamics going on. Our members really wanted to get a budget. They were not happy. Nobody was happy, with the exception of maybe Dick Sasloff, who would hold his breath until he turned blue, but really wanted to not have a budget by June 30th. And our members take that very seriously. That is job one for them, getting that budget done. They don't want to hold you all up. They didn't want to hold up the schools. They didn't want to hold up the institutions trying to sit there to push be able to get closure on this process. A little bit of detail here on this $842.5 million that is sort of baked into the budget. Joe mentioned higher education. There was some discretionary spending for that. Public education, we had discretionary spending there as well. There were a couple of savings items. In the Senate budget, we actually had a 2% increase in 16 for teachers, state employees, state-supported locals. That went away. And then we had about $177 million in various balances, a few kind of one-time givings, if you will. And I say that in recent years, we have really worked hard. Our members have done a great job in terms of unwinding a number of the gimmicks that were used to balance the budget during the 2008 long-term recession that we had to deal with. So, we're reluctant to have to go back and use those strategies, such as the accelerated sales tax. This is requiring vendors and retailers to pay their July sales tax essentially in June. So, we're trying to be careful not to get too gimmicky, also knowing that we might have to come up with some more creative solutions a little bit later. But we did do a couple of one-time things to generate a little bit of cash. I will say, though, that we did a pretty good job, I think, of preserving much of what was in the budget as introduced and much of what the very core mandated high-priority services that are required in the budget, since the SOQ benchmarking, that's pretty much intact, I would say. Joe talked about Medicaid utilization and inflation. We did not do anything to short sheet the VRS. We left that entirely intact so that we're on track with our commitment there. Debt service payments, as Jim mentioned, nothing there. We had a rainy day fund deposit, and really tried to minimize the direct impact of some local governments. We didn't do any across-the-board cuts or anything particularly direct in terms of impact on local governments at that point. The rainy day fund, there was a question about this. If you can see here, the balance. In 2008, before the recession, you can see where we started making withdrawals from the fund. In 2016, the balance is expected to be about $940 million. And as Jim observed, you can only take either half of the shortfall or half of the fund. Well, half of the shortfall is going to be much larger than what half of the fund balance is. So we can only get about $470 million out of the fund. That means about $237 million in FY16. And we're going to need everything. And then the revenue reforecasting process, I mentioned this. If the revenues fall short by about 1%, the governor is required to get his revenue forecasting groups back together. There's one group called the Joint Advisory Board of Economists. There are probably 10 or 12 economists from higher education, industry, not higher education, they're academia, industry, banks, what have you, and they all opine as to what's going on. And I have to say, I get to sit on that group, and it was interesting because some of the ones who say, I'm always upbeat, I'm always blessed, 3 quarters full, they were very pessimistic. So I thought that was educational that some of the ones who are even kind of Pollyanna when it comes to forecasting were more negative this time than what we've heard in the past. And then the Governor's Advisory Committee on Revenue Estimating, that is a group of business leaders and also our legislative members. They sit on that group and they react to the forecast that the Department of Taxation develops based on what this Board of Economists has told them. So as you might imagine, it was pretty, it's all confidential, we're not supposed to talk about, but suffice it to say, it was rather pessimistic, and you'll get the results of that process tomorrow from the governor. I would expect that the governor would give you some idea. He'll give our members and then you all at 3 o'clock tomorrow how he plans to proceed with dealing with 15. That's going to be the tough issue. He will have his budget before us when he releases it in December, and at that point he can fine-tune FY16, but obviously 2015 has to be dealt with post-haste because you all have to know what you're dealing with. The agencies have to know. You can't wait until the General Assembly meets and finishes its budget next March to know how you're going to deal with 15. So I'm assuming, as Governor King did, I think in and it has declined in overtime. Also due in part to the fact that age of individuals has increased. The state agency's piece has not grown, but debt service of age individuals has definitely grown over time. Car tax stayed flat, CSB's local sheriff's other aides probably also less than what it was as well. Clearly we're anticipating that we're going to see this weak, rather flat revenue growth for a number of years based on the data that Jim shared with you, that we're just not seeing the growth in the high-paying jobs. It is more middle skills, lower-paying jobs. And again, as we look to balance this budget and deal with this additional shortfall that the governor will announce tomorrow, we're going to avoid the one-time strategies as much as we can. So what does that mean for you? It means possibility of deeper cuts. Because when we don't temporize and do the easy, shortcut things like we did with the BRS back in 2010, it makes it harder for you all. And that's what you're going to see. I cannot envision any environment where we would go back to the BRS well. I think, we learned our lesson there. And the rating agencies really keep an eye on that. Those are the ones who monitor our bond rating. They very much like what we did with our BRS, our commitment to repayment, and I can't see Secretary Brown saying, guess what, S&P and Moody's, we're not going to fully fund our BRS commitment. Can't see that happening. Clearly, there's pressure to address teacher and state employee salaries. I think as a couple of folks have mentioned, we haven't done much on that, haven't done virtually anything in that regard in recent years. K-12 education has not regained the funding that it lost during recession. Higher ed had regained some ground, done pretty well in recent years, and they will probably lose that ground, if not a little bit more. That's going to be difficult because there is quite a lot of pressure on the schools not to just turn immediately to the tuition well, and that's going to be kind of tough for them. You've got a couple of other issues in the background. Gas taxes are likely to rise. Jim mentioned in 2313, House Bill 2313, that was the transportation package. There's a little bit of a trade-off if the gas prices do go up. I don't think we take that next chunk of the sales tax, as I recall, and we take that diversion. Up to 16. That's right. Good. And then just the general tone and dynamic in the General Assembly. As you know, the Senate has flopped back and forth between Democratic leadership and Senate leadership. And, frankly, for us, for our committee and our staff, we have two great co-chairs, Walter Stoshel and Chuck Holden. They provide a lot of stability and a lot of, moderate, reasonable leadership, I would say. So that's great for us, but it is a dynamic that has to be considered as the body flips back and forth. The relationship with the House hasn't been that great. The relationship between the House and the governor hasn't been that great, and sometimes between the senator and the governor hasn't been that great. That's all by way of background in terms of what we're going to be dealing with. At this point, I'm going to turn it back over to Joe to talk a little bit about closing the coverage gap and what that means for your local governments.
I'd rather Jim do it, actually. So, for the third year in a row, we're likely to talk about closing the coverage gap in the General Assembly. For the second year in a row, the Senate did take the lead on trying to come up with a solution to close the coverage gap. We spent a lot of time internally coming up with different strategies. I think that the leaders in the Senate, Senator Stosh, Senator Hanger, Senator Watkins, and some of the other members of the Finance Committee tried to come up with a common sense solution, like Betsy said, to try and recover or to recapture the dollars that are essentially floating across the Potomac. So they wanted to recapture or return $1.6 billion a year to the Commonwealth, to your communities. You've probably heard the figure that we're foregoing $4 to $5 million a year if we do nothing. That's simple math. That's dividing, it should be 1.6 billion by 365. It's about $4.3 billion. It's coming up on about $920 since January 1st of this year. Again, that's money that could have gone to local communities. We did look at trying to use a cost-effective delivery system. We have a very mature managed care industry in Virginia. We're one of the leaders. We've been doing this for about 20 years. So we were relying upon private insurers to deliver care. There was skin in the game on the part of new enrollees, so there's not, they weren't getting something free. There were limitations on the part of Medicaid because you are dealing with low-income people. But as Betsy mentioned, this also would have freed up, or can free up, over $200 million for the biennium to offset some of these reductions that we're likely to see. And that's because state funds currently subsidize indigent care at your local hospitals. They provide inpatient treatment at our DOC facilities, and then also your community services board. There's a number of folks that are uninsured that could be covered if we decided to move forward with Marketplace Virginia or some other alternative. For localities, what does it mean? It means shoring up the fragile finances of the local hospitals in your communities. Those same hospitals fund your free clinics and provide linkages with the community health centers. So you could shore that up. You can improve access to comprehensive health care in your communities. And you could also infuse the mental health system, which as we know is woefully underfunded in the Commonwealth, and we saw some of the results of that in November. You could infuse the system with over $200 million for primary care, access to prescription drugs, and also community-based treatment. Some of the other challenges that we're going to face going forward are those investments in behavioral health. The General Assembly builds upon what Governor McDonald sent forward, adding about $63 million, I believe, in community-based mental health treatment and some state facility care as well. We increase access to funds for children's services and youth, added funding for drop-off centers like you have right here in Rankin County that does a bang-up job working with law enforcement to respond to individual need crises so that we keep them out of more expensive settings. And then we also added funding for programs on assertive community treatment. We're often called hospital-acquired wellness. I would just remind you that the last time we infused significant resources into our mental health system was back in 2008, after the tragedy of Virginia Tech. We went into recession the next year, and a lot of those dollars went away. So I think, as Betsy mentioned, we're unlikely to make that same mistake again. DOJ, downsizing of our training centers, depending upon which communities you're in. I'm sure you're hearing about that. We're trying to do a better job of making resources available to ease the transition of individuals out of our training centers. And you guys have helped with that. I know Chesterfield just announced last week that with their own resources, they built a 12-bed facility at the courthouse in Chesterfield to enable individuals to move out and serve people that are on waiting lists for care. So you guys have certainly helped. Another area where you have helped is just addressing the roles, the caseloads, and also the applications for TANF, for food stamps, and for Medicaid. And how did we reward you over the last few years? I'm afraid to say we took back your funding. So thank you, because you addressed unprecedented caseload growth. I remember going to Culpeper a few years back, and they were seeing people that they'd never seen before. So if it weren't for you guys out there and your staffs doing the work that needs to be done to handle these caseloads, we would have been in a world of hurt. So hopefully we've tried to put back some of those funds. I know that we're nowhere near where we need to be. And then to sort of add insult to injury, but it also coincided with enhanced federal funding, we decided to remake our eligibility system. And I'm sure you've heard about that. I think we're doing a better job. I talked with DSS earlier in the week. There were some bumps in the road. They shortchanged training. It's a complicated system. I know that you guys have been working with an archaic system, and that's unacceptable. And so hopefully, with some of the resources that the federal government made available through the Affordable Care Act, we can make some of those changes that need to be made and better manage the caseloads that are out there. And also, you guys have really experienced a mini surge in terms of applications for Medicaid. What's interesting is that you've seen an extraordinary increase in the number of applications at the local level. But a lot of those people aren't eligible because they would be eligible for Medicaid, but we haven't made a decision whether to move forward with that. When and if we do, I think it'll be easier to manage the caseloads, but we're certainly not there yet. To wrap it up, as I mentioned, it was sort of a tale of two sessions. At the beginning, some of the holes that have been created through the years, roll back some of the gimmicks that we had to put in place to balance the budget, and then make some small investments in higher education. Unfortunately, we had to pull those back as the revenue picture did deteriorate in that. There's no shortage, as we mentioned, of budgetary challenges that we're going to face at the state level, and of course you see firsthand at the local level. And certainly those will have to be taken up to the next session. And then we're obviously going to have to make reductions at the 2015 session, and unfortunately you can't wall off everything. Core services may be on the list, but hopefully we can minimize some of those reductions. So with that, Betsy and I can hang around if there are any questions. With that,
Thank you. Let's take a couple of questions.
Yes, ma'am.
On your slide where you showed where the reductions were taken from the various areas, were those reductions from actual budget line items or just from the additional programs and funds you were planning to allocate?
Largely from the incremental funding that we were planning to provide. So we really didn't go too much into base funding, if you will. It was more of the incremental funding. And even that was largely incremental funding on top of what Governor McDonald had proposed in his budget in most areas.
Other questions? All right. Thank you very much. Very good. And now I'm happy to introduce our final speaker of this afternoon. And don't forget, immediately after